into a space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Rednam.
Welcome back to the Confidence Doc podcast. I'm Dr. Rednam. I'm a board-certified plastic surgeon in the Houston area with my Houston surgeons. Today, I want to talk about something that's kind of difficult: recovery, right? Everybody thinks about plastic surgery maybe at one point in their life, and you toy with the idea, am I going to go through this? And you get really excited for the day. But a lot of people don't put that much focus on the recovery. And let's be honest, the recovery is actually the harder part of surgery. You get through the surgery, everything goes well. You get a year out, you're happy, everything goes well. But that in-between time can be really challenging. A lot of people, I think, underplay that when they're in their consultations from a plastic surgeon standpoint, because we have someone who's excited. We want to help them achieve their results. But I will tell you, I do like to put a lot of emphasis during my consultations on what we are going to do for recovery. Recovery is not just you. So that is absolutely not a good way to do it. You want to make sure with recovery you have a team. That team may be your family. That team may be outside help. That team may be not just your doctor, but maybe a massage therapist. It may be a mental health care provider. There's so many people that can be involved with your team. And the most successful recovery involves that kind of group care. We talk about it takes a village to raise a child. It takes a village to help you through recovery as well. And that's because that's a healthy recovery. While we want you to get through your surgery, we want you to do well, not have any problems, we want you to do the same with your recovery. We want you to feel supported, and we want you to heal in a really positive environment. A lot of people will focus on, I'm going to have my surgery, I'm just going to be holed up in my house, and I'm going to be fine. Well, let me tell you, when you do that, you're not doing both your body or your mind a favor. Being holed up like that, not having good support, you really go through a lot of post-surgical depression with that, because we need people to help us recover. We need to get up and we need to walk, and that requires help, especially with big body procedures. Also, physically, you need to make sure you're eating well. You need to make sure that you're drinking plenty of water. You need to make sure you're taking walks. All of these things are difficult and challenging, and when you're in that excited phase, you're like, I got this, no big deal. I've got this time off. I don't need anyone to take care of me. And it's just not the reality of it. I think that we need to put a lot more focus on the recovery so that it's a good experience. I have had so many people who have come to me for secondary procedures. I didn't do their original procedures, and they're like, oh my God, I had the worst experience with my tummy tuck. I never want to do that again. But if I really dissect it, it's not the surgery, it's not the results, it's the recovery. That's really what was horrible for them. And it doesn't have to be that way. So what are some things that I personally do to improve recovery? One is I always use something called Exparel, and that is a long-acting numbing nerve medication. I say nerve medication because you can actually block the nerves to multiple parts of your body, so whether it's your chest, your abdomen, your back, and you can provide this long-lasting pain relief on top of your pain medication. It is the first few days when you have the most discomfort. And so if in those first few days we can turn the volume down, you'd be surprised at how much better you do even when that numbing wears off. Second is I make sure that my patients have really, really good support afterwards. I recognize that I by myself could not provide that, nor my team. And I will tell you, I got the best team out there, and they are always there to help, but we realized we needed extra help. So that's where I bring in a group like Pop Recovery Systems, who helps from the mental health care, from the nutrition, and from just the general, let's get things coordinated standpoint. The next big thing I think for the recovery is actually visualizing. And I tell my patients, you should visualize yourself going through this surgery, recovering, getting back to work. And some people say, gosh, that seems silly. No, I mean, race car drivers do this. They visualize going through their Formula One track. It is a known exercise that helps. So when you're visualizing yourself going through that, you'd be surprised at how much better you do because you have this positive aspect. You've already seen yourself on the other side. And I really, truly believe that that makes a difference in your recovery. I think at the end of the day, too, you really, really have to prepare yourself for when you are back at work, right? If you are a person that does not have to work afterwards and you have a lot of time for recovery, that is fabulous. And then you can really take your time getting back into your daily routine. Most people do have to get back to work. And for some people, that might be involved sitting at a desk and being relaxed. For others, it might actually be on your feet all day, making coffee for people. Who knows what you're doing for work, right? And if that's the case, you have to make sure that you've set yourself up so that you're not just killing yourself at work when you're back. So that might mean talking to your boss. It might mean talking to your coworkers. So there is a lot more involved than just picking a date and saying, I'm ready, let's get this body that I've always wanted. There's a lot of planning to do. And as an office, we try to help you. We try to prepare you to say, hey, these are things you need to look through, and having that support system. So whether that's family, friends, a recovery group, you need to make sure that you're preparing so you can have the best results. And so that it's not like, oh God, I had the worst recovery, but I love how I look. It should be like, you know what? It was tough. It was challenging, but man, I felt so supported and I felt so good that I might want to do this and recommend this to other people in the future. I hope this helps you understand how important recovery is and that it's not just a passing thought. It should be just as important as picking your surgeon, deciding what surgeries you're having. All of that is just as important as deciding what is my recovery process going to look like. So pay attention to your recovery. It's important. Make sure you're with a doctor and with a group that are listening to that and putting a lot of focus on your recovery as well. I hope you enjoyed this quick episode talking about the importance of recovery. If there are other things you'd really like me to focus on and do these quick little shorts on, please let me know and drop it below in my comments.
As we wrap up another episode of The Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.